Hello, and welcome to the University of Tennessee Orthopedic Institute. My name is Kiki McKissick, and I'm the Orthopedic Coordinator here at UT Medical Center. And today, we will discuss your total joint replacement. As your healthcare team, we understand that surgery can be a stressful experience. We want to address your concerns by providing accurate information and educating you and your loved one about your total joint journey. Shoulder replacement surgery. The shoulder joint can be replaced by an artificial shoulder or shoulder replacement for pain caused by arthritis or when the shoulder is severely fractured or broken. Arthritis is when the cartilage of the ends of the bones, they're gone, and there is bone rubbing on bone in the joint. Arthritis can be caused by fractures, rheumatoid arthritis, torn rotator cuff tendons, or just by wear and tear over time. Our class goals. Our goal is to provide outstanding quality care and improve the quality of your life through increased mobility and independence. The goals for the class are to help you prepare for your surgery, help you understand what to expect during your hospital visit, and to help plan your recovery and to ease your anxiety. Okay, let's talk about getting ready for surgery. There are a number of ways you can prepare your home for your return after surgery. Plan to have help at home for at least the first few days after surgery. Have a family or friend that can assist you with meals, bathing, dressing, and to take you to your follow-up appointments, and also for your outpatient therapy appointments. Consider arranging furniture so you can move easily through the house. Have clear and lit pathways wide enough to use a walker. Bathroom tips. Prevent slips and falls by installing railings and non-slip surfaces. Check existing grab bars for strength and stability, and repair if needed. You and your therapist may discuss ways to raise the height of your toilet seat. Make bathing easier by using a shower hose, liquid soap, a long-handled sponge, a bath bench or shower chair. Watch out for hazards such as wet floors. Draw off in the shower to prevent bringing water out onto the floor. Stock up on toiletries and other items that you may need during recovery. Let's discuss how to access your joint replacement guidebook. If you are using an iPhone running on iOS 11 or later, simply open your camera app and point it at the code. Once your camera recognizes the QR code, a notification will pop up with features to a link. Tap on the link and your phone will direct you to the proper website. If you're an Android user whose operating system is Android 9 or later, it's the same process. Just open your camera and point it at the QR code. Make sure you hold your phone steady so your camera can recognize it. Once it does, a notification will show up and the link to your correct website will be there. As you continue to get ready for surgery, keep in mind that you will not be allowed to drive until cleared by your orthopedic surgeon and when you're no longer taking pain medications. Take a look at your medicine bottles and get refills before your surgery. Consider preparing and freezing or purchase small portion meals for times that you may be alone. Stock up on staples that can be frozen for later use, such as bread, vegetables, and fruit. Unless otherwise directed by a doctor, try to drink at least 8 8-ounce cups of water per day. Medical clearance. Pre-anesthesia testing is a requirement before surgery. It is a medical clearance process provided by UT Medical Center to assess patients before they undergo anesthesia for surgery. So, for your PAT or pre-anesthesia testing appointment, bring insurance cards, photo ID, and a complete list of all medications that you take, including vitamins and minerals. During this appointment, you will meet with a nurse who will go over your health history. You will also have blood drawn and an EKG. You will be told what medications to stop taking before surgery and when to stop taking them. You will not meet with your anesthesiologist during this appointment, but one will review your health records. If there are any concerns, you will be contacted and referred to a specialist for additional medical clearance if needed. If there are any changes in your health after your PAT appointment and before your surgery, please contact your orthopedic surgeon. Dental checkup. You may ask, what does my teeth have to do with my total joint? Well, bacteria can easily enter your bloodstream through your mouth during a dental procedure and cause widespread infection. To minimize these problems, schedule a dental checkup in the months leading up to your surgery, if you haven't had one already. Continue to brush and floss your teeth regularly. After surgery, remember to inform your dentist of your new total joint. Preventing infection. Here are some of the ways that we prevent infection. With the use of benzoyl peroxide for preoperative skin preparation. We also use alcohol-containing antiseptic agent for preoperative skin preparation. We give IV antibiotics before, during, and after your surgery. And also, you will receive a nasal antiseptic swab right before surgery. Benzoyl peroxide cream. Studies show that applying this cream to the shoulder area reduces the number of bacteria on your skin that could lead to a surgical site infection. You will begin using the cream 2 days before your surgery, twice a day. You will also need to use the cream the morning of surgery. Apply a $half size amount of the benzoyl peroxide cream to the entire operative shoulder and armpit area after bathing. Seek immediate medical attention if you develop wheezing or difficulty breathing, swelling of the face, hives, or severe rash after using the cream. If you have ever had an allergic reaction to benzoyl peroxide, do not use this cream. Instead, use antibacterial soap. Please note, you may have some skin irritation or develop a mild rash after using the product, especially under the armpit. This can be a normal reaction. Please continue to use the cream. If you have any questions or concerns, please contact your orthopedic surgeon's office. Continue infection prevention. Staph aureus is a bacteria that can cause skin infections and potentially infections of the bloodstream, bones, and joints. This bacteria is commonly known as MRSA. 25 to 30% of people carry the bacteria in their nose or on their skin. This bacteria can remain silent and never cause infections, but patients who are carriers of Staph aureus are at a higher risk of developing a surgical site infection. To reduce the risk of infection, we provide a nasal swab to every patient on the day of surgery in the pre-op area. This swab is an antiseptic that will decolonize bacteria and decrease your chance of an infection in your new joint. Preventing infection at home. Remove clutter and clean your home before surgery. Place clean linen on your bed before coming to the hospital. Wash your hands before touching any area around your surgical site. No pets near your surgical bandage and no pets in your bed during recovery. I know we like to think our little pets are clean, but their little paws and booties can carry germs that we just don't want near your surgical site. And always keep your surgical bandage clean and dry. The do not list. Stop taking NSAIDs, for example, ibuprofen, Advil, Motrin, Aleve, aspirin products, blood thinners, and arthritis medicine 1 week before your surgery. Do not shave your legs 7 days before surgery. It's okay to shave your face and your underarms using a new razor. Do not wear lotions, powders, or deodorant the day of surgery. Do not wear contact lenses, makeup, lipstick, or nail polish on the day of surgery. Leave jewelry, credit cards, and large sums of money at home. And do not bring any medications with you to the hospital. Countdown to surgery day. 2 days before your surgery, pack for the hospital. Less is best. Don't overpack. Apply the benzoyl peroxide cream to the entire operative shoulder, including the armpit area, twice a day as well. Day before surgery, apply the cream twice a day and do not eat or drink anything after midnight the night before your surgery. The day of surgery, apply the benzoyl peroxide cream before coming into the hospital for your surgery. Only take small sips of water if you have been instructed to take morning medications. What should you wear to the hospital? Well, most patients are here for a short period of time. Consider oversized or loose-fitting clothing, shoes with a closed heel, pants or shorts with an elastic waist. If you plan to stay overnight in the hospital, bring your CPAP machine to use for bedtime. If you use a CPAP machine at bedtime, keep in mind you will be required to sign a form stating that it's safe to use your CPAP machine while you're inside the hospital. Surgery day. If you're having surgery at UT Medical Center, you should park in parking garage number 1. You will enter through the Fountain Circle main entrance of the hospital and go to the patient admitting office. You will be registered for surgery, go over forms, and receive ID bracelets. You will be directed to the surgery waiting room and your family may go with you. If your surgery is scheduled at the University Orthopedic Surgery Center, park in the upper parking lot designated for patient parking. Enter through the front door and straight ahead is the main entrance to the surgery center. Please check in at the front desk. After registration, you will be taken to the pre-op area. If you have glasses, hearing aids, or dentures, we ask that you bring it in a labeled case or a labeled bag. In the pre-op area, you will have your IV started. You will receive your first dose of IV antibiotics. You will also meet with your anesthesiologist to discuss your anesthesia options. In the pre-op area, you will also receive the nasal antiseptic swab. After your nurse has prepared you for your surgery, your surgical nurse will take you from the pre-op area to the operating room for your surgery. Your surgery will take between 1.5 to 2.5 hours. During surgery, your nurse in the operating room will update your family with a phone call. After surgery, you will wake up in recovery. Most patients are in recovery for 2 to 3 hours. If you are going home same day of surgery, after the recovery room, you will go to Phase 3 recovery. In Phase 3 recovery, you will work with physical therapy, and your nurse will go over discharge information and medications with you and your coach that came with you to the hospital. Prescriptions are usually sent to the outpatient pharmacy within the hospital, and you can pick them up before leaving. If you're having surgery at the surgery center, your discharge prescriptions will be sent to your preferred pharmacy electronically. Safety and fall prevention in the hospital. Our focus is to keep you safe by preventing falls. Remember that the hospital is not your familiar environment. You may be connected to cords, pumps, or other equipment. Your nurse will evaluate and monitor your risk for a fall. If you need to get up for anything, use your call button for your nurse and wait for a care team member to help you get up out of bed or out of the chair. Do not get up alone and do not rely on family or friends for assistance. Ice therapy. Ice therapy is used to help control pain and swelling, and you are encouraged to use ice therapy frequently after surgery to minimize post-op pain and swelling. Incentive spirometer. An incentive spirometer is a small handheld device that helps you take deep breaths. This helps to expand your lungs more fully, preventing respiratory complications after surgery. Your nurse will teach you how to use the incentive spirometer. It is very important that you use your incentive spirometer at least 10 times every hour while you are awake. We recommend you use it more often if you have a low-grade temperature. You will also be encouraged to cough and breathe deeply. Be sure to take your incentive spirometer home with you and continue to use it for 2 weeks after surgery. Pain management. Controlling your pain is very important to us. You will be asked to score or rate your pain on a scale of 0 to 10. 10 is the worst pain and 0 is no pain. By using the pain scale, we will be able to monitor your pain level. So remember, you will have some pain after surgery. Everyone's pain is different. Motion is lotion. Pain is a part of the recovery process. Minimizing the risk of constipation after surgery. After surgery, constipation is a common problem. Pain medication, decreased activity, and changes in your diet all interfere with your normal bowel pattern. If you are experiencing problems with constipation, you may take over-the-counter laxatives or stool softeners, such as milk of magnesia, Docalax, or Colace. Taking less pain medication can also lower your chances of constipation. After surgery, you will have several tools to help you during recovery. Tools such as narcotics for pain control, nerve pain medication, maybe nausea medication, ice therapy, Tylenol, stool softeners, and laxatives. These are all your tools that will help you during your recovery process. Now let's talk about how to take your pain medication at home. Take medication as prescribed, but also as needed. For example, take every 6 hours as needed for pain. This means to take pain medicine when you start to hurt, but no sooner than the time on your prescription. Take for breakthrough pain. An example of breakthrough pain. Say you take a pain pill at 8 a.m. and you can't take another until 2 p.m. and you start to hurt during that time. This is called breakthrough pain. Ways to manage breakthrough pain: ice therapy, Tylenol, and some doctors will order other medications to help with breakthrough pain. To help manage your pain at home, stay ahead of the pain. Take pain medication 20 to 30 minutes before physical therapy. Apply ice. You do not have to set an alarm during the night to take pain medication. If you're sleeping, then your pain is considered under control. Shoulder sling, shoulder immobilizer. You will wear a sling after your surgery. Your doctor will advise the length of time you will wear your sling. We will teach you and your family how to take the sling on and off. Your surgeon will instruct you when you are able to stop wearing your sling. It is okay to use your hand for simple things, such as typing, holding a cell phone, or holding a newspaper. But remember, do not lift over 1 pound in your operative hand. Discharge from the hospital. Planning your discharge began in your surgeon's office before your surgery. We do this so we can provide the most comprehensive plan of care for you and your family. Sometimes there is a need to adjust your plan depending on your progress. You will leave the hospital when you are medically stable and meeting your therapy goals. You will be discharged to the Fountain Circle entrance where your family can meet you to take you home. Most people go home after joint replacement surgery. Even if you and your doctor plan for you to go home after surgery, your recovery may be slower than expected. As a result, you may need to go to a skilled nursing facility. Before surgery, it's important to decide on the facility you would like to go to after you leave the hospital. Find a second and third choice option. If there is no bed available in your first choice facility, the hospital will still need to transfer you to another qualified facility. Make sure that your surgeon is aware of your discharge plan. At the skilled facility, you can expect a regular nurse and physician presence. In-house rehab services such as speech, occupational, and physical therapy. You will also have more medical resources available to you. Your insurance carrier must give approval for you to go to a skilled nursing facility. Your hospital case manager will help coordinate your skilled nursing facility transfer. Things to consider packing for a skilled nursing facility stay. Toiletries, such as shampoo, toothpaste, deodorant, lotion, and any other personal hygiene items you may need. Some facilities have these items available, but they may not be your favorite brand. Pack comfortable clothing, clothes that are easy to put on and off. Think about entertainment. Pack books, magazines, puzzles, or games. Consider personal items such as your favorite blanket or pillow. Pack personal items to make your skilled nursing facility more comfortable. For more information, contact your facility of choice for more detailed information about that facility. Pain medication. The state of Tennessee has very strict laws that your surgeon must abide by when prescribing pain medication. There are restrictions on how much pain medication your surgeon can prescribe for you. These restrictions are determined by the state of Tennessee and not your orthopedic surgeon. Please discuss with your surgeon if you have any questions regarding your prescriptions. For your convenience, the medical center has an outpatient pharmacy that can fill your medications for you before you leave. Please let your nurse know if you'd like to have your medications filled here at the medical center. Who to call? Call your nurse navigator for questions about preparing for your surgery. Call your orthopedic surgeon's office directly for appointment scheduling and rescheduling, surgery scheduling or cancellation, questions about PAT, prehab, or physical therapy. If you need prescription refills, you will also call your surgeon's office directly. Call when you start to run low on medicine. It can take up to 48 hours for prescriptions to be refilled. If you have questions about your insurance, also call your orthopedic surgeon's office. The phone number is 865-546-2663. And lastly, thank you. Thank you for choosing UT Medical Center Orthopedic Institute to be with you on your joint replacement journey.